Did you know? The diet first appeared in English in the 13th century. It is a selected food to consume in order to reach a winning weight or for medical reasons. Diet advances over time, and it is affected by several factors like incomes, the price of food products, human tastes and beliefs, cultural traditions, as well as regional, environmental, and social variables. When it comes to a healthy diet, we can learn a lot from around the world. Because of that, individuals are over-consuming animal products, typically saturated meats and chemical additives that are heavily manufactured. Following these several diet plans or after getting gym membership, we didn't pay that much attention to what we were actually consuming. At the end of the day, we found ourselves nutritional deficiencies and suffering from osteopenia, sarcopenia, and anemia. And always having confusion in mind. Is their diet healthy or scientific? What are the basic elements that should be present on a proper diet? After insights from reports, we figured out all these questions, but before saying that, let's talk about some common nutrient facts. There are 3 major macronutrients groups that we are going to pay most attention to. Proteins, lipids, and carbohydrates are involved in this. These are 3 nutrients that we will discover in every meal we eat every day. The U.S. standard diet consists of 35% fats, 15% proteins, and 50% carbohydrates. So, you may ask, is this a standard diet that you should follow? After decades of research on the so-called science-backed diet, Dr. James O'Keefe, Director of Preventative Cardiology at St. Luke's Mid-America Heart Institute, suggests 3 healthy diets that are scientifically proven to be effective for maintaining healthy lifestyle. First one is Nutritional Mediterranean Diet. This is a gold standard diet for those who have or are at risk of heart diseases. It includes plant foods, fruits, vegetables, legumes, whole grains, seeds, tree nuts, and olives, fish, and olive oil, along with moderate amounts of dairy products, particularly yogurt and cheese, and eggs. Reduce and maintain weight, improved heart and brain health, prevent and control of cancer and diabetes. Reduce stroke risk for women. Prevent cognitive decline in Alzheimer's disease. May help to ease depression. Next one is Blue Zone, which is also called plant-based diets. If you are type 2 diabetic patients, this is only for you. This diet is high in vegetables, meat, fish, eggs, fruits, nuts, and fats, but low in starches, sugars, and processed foods. Preventing heart diseases. Reduce risk of cancer and diabetes. Help to reduce cholesterol, blood pressure, and blood sugar. Support to maintain healthier weight. Reduce the development of certain types of cancer. Improve signs and symptoms of rheumatoid arthritis. If you are obese, try to find fundamental diet routine for you. The next diet is only for you. Intermittent fasting, time-restricted eating, is the practice of limiting the daily intake of calories to a window of time usually between 6 to 12 hours each day. It differs from any other diets because there are no recommended foods that are eliminated or restricted. So, during an eating phase of an intermittent fasting diet, you can eat whatever you want and as much as you want. Smarter approach in the treatment of obesity. Reduce the risk of pre-diabetic stage. Improves high blood pressure, insulin sensitivity, oxidative stress. Increases stress resistance and suppresses inflammation. So, focus on your diet quality rather than counting benefits of individual diet. You may choose different diet options for ethical, environmental, or health conditions. As with any type of diet, these benefits only appear if you maintain consistency and create your healthy plate with nutrient-rich plant foods rather than heavily processed ones.
Thanks for watching our video. For more healthy experiences, subscribe to our channel and keep yourself updated by pressing the bell icon.